Well, let's talk about the work that is being done, the status of that. And of course, there are two or three major areas of focus of the Aging Initiative. Let's start with elder abuse, which was one of the big ones. Elder abuse, which is largely a hidden crime, as we discovered on this show when we did the segment. The fact that only 1 out of 23 cases is actually reported, and even that number is questionable. We just don't know. How has the grant enabled agencies to tackle this almost invisible issue?
We finally, and I think for the first time in this community, when elder abuse occurs, we have a coordinated response to make sure that that senior who needs help gets it, and that they get it in a timely manner, and that it is a complex but comprehensive number of services that they can receive.
It's bringing together a number of different organizations.
A number of different organizations, including government, like law enforcement, the District Attorney's Office, the Cris Foundation, Maritan, which used to be Senior Services, is helping us with housing, the Aging Commission, Memphis Area Legal Services, Community Legal Center, and others are all working together to make sure that someone who needs help is getting it in timely fashion. That can be housing, if they need a safe, secure place to stay, to get away from an alleged perpetrator. That can be medical care if they need it for physical abuse or something like that. That can be conservatorship or public guardian legal assistance if they need it as well. So we're making sure that that rapid response and that intervention is there for our most vulnerable who need the assistance.
How well is the coordinated response team working?
We think it's working very well at this point. It's interesting that when we began, that a lot of these agencies didn't really know one another or what resources that each organization had to provide. Now, after almost a year into it, they know one another on a first-name basis. They know who to call. They have each other's cell phones. They're on call all the time and sharing that information back and forth.
Now, the program's been up and running for a few months. Are you seeing tangible results?
Sure, we are seeing tangible results, and some of those, for example, we are increasing the percentage of cases that are being prosecuted for elder abuse. So when working with the DA's office, because of the information they're getting from victims advocates, that they're getting from the police department, and because of their concerted efforts on these cases, they're able to, in many cases, upcharge these to elder abuse, whereas in the past they've not been able to do that. So we're seeing an increase in prosecution. We are seeing certainly an increase in training in terms of the number of individuals that have been trained on these issues and made aware that what to do, and that we're all mandatory reporters. We have both quantitative and qualitative data. Quantitative meaning that we've got hard numbers that show that, for example, for every $1 the Plough Foundation has invested, we've been able to leverage almost $9 in other resources to help these victims. And on the qualitative side, we can say that we've had more than 100 clients in the short time that we've been working, and we've been able to close more than 50 of those cases, knowing that the victim or the client is in a better situation than they were when they came into the CREA system.
Let's turn our attention to the Aging in Place initiative. Your own research, I think, revealed that 94% of Shelby County seniors said they wanted to live in their homes for as long as possible. That's only natural. What success are you having with the Aging in Place initiative?
I think we're having great success. First of all, the need for this program has been immensely validated. When we put out the numbers and information about the program, the first day that people were able to call Habitat for Humanity to sign up for services, so many seniors called that it shut their phone lines down. So that was said to us that yes, this was a grant that was definitely needed.
Now this is, remind me, it's a 2-year or 3-year grant period on the Aging Place?
It is a 2-year grant.
What do you hope to have achieved at the end of 2 years? Because you mentioned the need. The need is so great.
Right.
The dollars from the Plough Foundation will only serve just so many.
Right.
Where do you hope to be at the end of that 2-year period?
Well, I certainly hope that we've enabled a certain number of seniors to age in place safely and securely in their homes. As Mike alluded to, the data collection here is also going to be extremely important. we're trying to figure out if aging in place and these home modifications improve the health status of seniors and keep them from going into the hospital because of falls or things like that. We're also looking, from an evaluation standpoint, to see if these home modifications improve socialization. Now that your home is improved, have you had more people over? How did you feel about your home before? How do you feel about it now? Has it changed your behaviors in the community? To my knowledge, this is one of the first times these kind of questions have been asked. And so I'm kind of a research nerd, I'll admit it, but I'm really excited about finding out more and digging in to see really what this construction does to improve the life of seniors. And we hope to share that out with other communities and with other funders in the hope that they'll see what a difference this kind of investment can make.
Let's move from shelter to food with the No Hungry Senior Project, which certainly has an important goal of trying to feed those seniors who are food insecure. They don't know where that next meal is coming from. That brings together also a number of different agencies. How well is that working right now? What progress are you making?
Well, the No Hungry Senior Project had a goal of reaching 350 clients by January of 2016, and they served their first meal on June 29th of this year and have already reached that 350 client goal with really without any advertising or marketing or awareness. Just through word of mouth, the need is so great that they've reached that number. As you point out, it is a collaboration of about 8 different organizations, including 2 major hospitals, Baptist and Methodist. The University of Memphis is involved, Catholic Charities, the Food Bank, and a number of other entities that are a part of this.
Where do you hope to be with this program at the end of the grant period? And again, the question about sustainability, because it's so important. You're serving a limited number of people, again, and the need is greater. So where do you think you'll be at the end of the grant period, and where do you want this to go after the grant ends?
So we hope to, if we reach our goals, hope to be at 3,000 clients at the end of the grant period, which should total somewhere around 1 million meals over a 3-year period that get delivered in some form or fashion. Some of those meals are coming through the hospital, so if a patient is going to be discharged and the hospital social worker knows that individual is food insecure, they will leave with a box of food. And one thing that we hope to do that we've talked about from the beginning is to connect the No Hungry Senior program to the CREA program, so that when you have individuals who are delivering boxes or delivering meals to the home, they know what to look for in the event in relation to elder abuse. So they know the kinds of things that might raise a red flag and might prompt them to make a report and have somebody come out and do a well check on that individual to make sure that they are not only not food insecure, but also not being abused in some way. So we want those programs to be able to collaborate together in the future as well.
The Plough Foundation has made a substantial investment of some $12 million
Correct.
in this aging initiative. What do you want Memphis and Shelby County to look like, its senior population, when the grant money has been spent and the programs are finished, in a sense, with their grant money? What do you want Memphis and Shelby County to be?
What we want it to look like when our grant dollars are spent is that we have 3 or 4 or 5 model programs that have additional funders, whether they be public, private, or combination, to sustain the work that we started, so that we can reach all of those that are in need, because the need is great and we are an aging population. 10,000 people a day turn 65. That's just, we're living longer, which is a good thing, but if you're in poverty already, or have lack access to health care or lack access to food, and you're living longer, it's a tough way, it's a tough existence. Beyond that, over time, I mean, we want to see a community that is more aware of its senior population, more senior friendly in terms of transportation and access, and also, you know, we've talked mostly about the downside of aging, but there are lots of people who are hitting 65 and in great health and have great minds, and who have something to offer the community but don't know where to plug in, and others aren't reaching out to them. And so that's something we'd like to see too, is that those individuals who are in good health and of sound mind are utilized for their talents and abilities.
I read this groundbreaking study recently that said that if you actually ask someone over 65 to volunteer, they're much more likely to. So just being intentional. When we think about mentorship programs, people that look like Mike and myself are asked to mentor a lot. We're very busy. He's raising kids. We're doing all sorts of things. How about our senior population? And connecting them with the youth of this community. The more caring, nurturing adults in a child's life, the better. So like Mike, I'd really love to see this age wave or silver tsunami utilized, connected, giving back, as they already are, but even more so.
Well, thank you both for being on The Best Times.
Thank you.